The stratification in MDS is very important to decide the eligibility to bone marrow transplantation. What is the most important treatment, because it's the only curative treatment. And in our vision, it's difficult, the access to the molecular stratification. And then we decided in the Latin America bone marrow transplantation register of MDS patients, we decided to study if the IPSS is a good parameter to stratify these patients and to correlate it with overall survival and progression-free survival. And then we did a retrospective study with 341 patients, and we stratified them by the IPSS, and we had about 11% of low risk, very low and low risk patients, about 25% of intermediated patients, and about 25% of high risk or very high risk patients. And we had a big problem in our region. Now it's a problem that we're trying to correct because not everybody has access to the cytogenetic. And you had about 4% of the patients that did not have stratification. And for me, it's a big problem because these patients go to transplant without exactly stratification. But when we studied the patients with stratification, we could correlate it completely with the overall survival. The patients with low risk that have better overall survival than patients with intermediate and high risk and very high risk. And surprisingly, that patients with not stratification had the same response of the patients with low risk. Of course, we have to discuss this, and we have to improve this. And the question is, in countries that you don't have access to the molecular analysis, we can use IPSS. In our study, with the bias of a retrospective studies, we can conclude this. One important point is that what exactly you can do with the molecular analysis, IPSS-M, and can adequate it to the clinical practice and what it can give us for clinicians in our decision. That's the most important points.